Good morning. I'm John Leggat, President and CEO of St. Amant. I want to acknowledge that the land we are standing on and the land where we offer our services are on Treaty 1 land, the traditional gathering place of the Anishinaabe, Cree, Oji-Cree, Dakota and Dene people, and the traditional homeland of the Métis people. Every time we acknowledge this truth, we have an invitation and an opportunity to reflect on what we can do to remove colonial barriers to our services and make Manitoba a better place for everyone who lives here. Welcome to our Spirit Cottage grounds. I want to thank Premier Pallister and Minister Squires for making the time to visit us today. Please welcome Premier Brian Pallister.
Morning, everybody. Great to be outside. Great not to be in BC right now, too. Incredible. First of all, thank you very much, John, for hosting us today. It's a tremendous pleasure to be here at St. Amant Centre, and I also wanted to thank Kirit Thakrar for being with us today and say thank you so much for your work as well as your organization's work in participating in our program. I look forward to hearing more about the initiatives you have underway in a minute. This is the President of the Hindu Society of Manitoba, by the way, and I thank him for joining us, and I also wanted to say a special thank you to my colleague and friend Rochelle Squires for being with us today, and hi, Rochelle. It's nice to be able to gather in small groups. I look forward to gathering together even more frequently as we continue through this journey together. But to get through it together, we have to do our best to get everybody vaccinated, and that's the topic today. Great to see so many people out this past weekend. I continue to be the stern dad that tells everybody to be careful, and I'm going to continue to say that. Be cautious, be careful. There have been resurgences of the COVID and its variants in other parts of the world where they have higher vaccine levels than we are yet to achieve. And it's important to remember that. Our number one priority in this province, as it is across our country and I think around the world, is to protect and safeguard the health and well-being of people. And we want to do that as best we can, and the best way to do that is to roll up our sleeves and get vaccinated. So I encourage everyone again to do that. That's the best way out of this pandemic. There are protection, not only individually, but collectively. There are protection against a fourth wave coming here and hurting us all. So I wanted to share some numbers with you today. First of all, I'm tremendously pleased to say that yesterday we set a provincial record and vaccinated over 35,000 people in one day. That's a new daily record, and I want to commend our vaccine task force for this work that they've done. It's been tremendous work, historic work, right? This is a project that we've never undertaken before and never want to undertake again. And so to our vaccine implementation task force, thanks so much to you. These are life-saving vaccines, and getting them into people's arms as quickly and safely as possible is critical. And I was just handed the updated numbers from this morning. Manitoba's ranking on 18 years old and up across Canada for vaccination levels on doses administered per 100,000 people, so relative to our compatriots across the country, we rank first in Canada. And on doses 12 and up, we now rank first in Canada as well. This is really important. As vaccine supplies from the federal government continue to ramp up, and we thank them for that, our teams have been able to get shots into arms as faster than any other province in the country. Is it legal for me to speak without a mask? I'm going to do that now and remind you all to keep yours on. To date, over 1.3 million doses of vaccines have been administered. That's more than 73% of Manitobans that have received their first dose, and we're almost to 40% on second dose as well. We expect to be close to 30,000 doses again today, and those numbers are really significant, and Manitobans should take pride in their efforts in getting vaccinated. Getting us to these milestones is important. This has allowed us to get some of our freedoms back, reduce some of our restrictions, cautiously, but we hope safely, of course. There's more work to do, and that's what I want to talk to you about today. Number one, not long ago, our limiting factor was vaccine supply. It isn't anymore. And we now have, as we approach 75% of eligible Manitobans vaccinated with at least one dose, Our challenge is to reach out to those Manitobans who are experiencing vaccine hesitancy, and there are lots of reasons why people may feel that way. And so it's important that we address those reasons. Accessibility issues, physical location, language barriers, cultural and religious beliefs and practices. All of these things can contribute to making one hesitant. And so we know from research and clinical leadership that there are thousands of Manitobans who are open to getting a vaccine, that would be ready to get a vaccine. I'm just not the guy to persuade them. Perhaps you are. The person in their neighborhood, the person they attend church with, the person they volunteer with in a community organization of some kind. These are the people to persuade. And so reaching out and helping people who you know and trust, and who know and trust you, to make a decision to get vaccinated is an important part of what we've initiated here together. And so I am really pleased to say today that our vaccine team has decided to provide 20,000 additional doses of vaccine directly to community organizations, to businesses and their employees, of course, and to other partners as well, to help Manitobans get fully immunized so we can get our freedoms back and get our lives back. That direct access is going to help us to overcome some of the barriers to vaccine accessibility, and vaccine uptake should be facilitated as a result of this. As a government, we are providing as much as we can additional inspiration, motivation, information to encourage people to make the decision they need to protect themselves and protect their loved ones and their community. But we have a lot more work to do. And so despite that earlier good news, remember that's just progress. And I'm a sports guy, so I'll say, it doesn't matter if you're ahead after 2 quarters, you got to be ahead at the end of the game. That's the deal. And so for us, we're only partway into this challenge. We need another 51,000 first dose appointments by Labor Day to hit our milestones. To reach 80% of Manitobans, we need to get 51,000 more unvaccinated people to get the shot. That's 20,000 doses I just referenced will get us part of the way there, but there's more work to be done. We recognize that not all Manitobans have the flexibility, the means, or feel comfortable in a large super site setting. Our super sites have been incredibly effective, but not for everyone. And so we're also wanting to help people who would feel more comfortable getting vaccinated in their place of work, or feel more comfortable in their place of worship, or in their local community center. And that's why just a few weeks ago we announced the Protect Manitoba, Protect MB, Community Outreach and Incentive Grant Program. And this is a new incentive program that provides up to $20,000 in financial support to sports organizations, cultural, religious organizations, community organizations, businesses, schools, to encourage vaccination in communities with lower immunization rates in particular. So my second announcement today is I'm pleased to tell you that the uptake, the interest that's been expressed in that program is most encouraging. We have had more than 600 different community groups and organizations inquiring and wanting to get more information on how they can get involved and how they can help increase vaccination rates across the province. That's a tremendous response. And today I'm happy to tell you that in just the few short days since we announced this program, we already have 25 projects that have been selected and are getting off the ground, and you're going to hear about a couple of those in a sec. And we have many, many more applications coming in as we speak. So I would encourage any Manitobans that are involved in community groups, organizations that can effectively reach out and encourage more vaccination uptake to get involved in this program, get your organization involved, and join the team. These initial projects include a wide variety of community groups and organizations throughout the entire province of Manitoba: cultural, religious, business, youth groups, organizations that work with vulnerable people, many, many more. Ensuring broad uptake across the province is crucial. We're all in this together, and we need the continued and sustained reopening of our economy to occur to help all of us and to help our small business people. Many of our small businesses are small family-owned businesses. We want to help those small businesses get back going again, doing what they do so well, providing services and goods to all of us. Vaccines are the best way out of this pandemic, probably the only way, and they are our protection against the possible fourth wave. They're how we get our lives back, and boy, we all want our lives back. Each of us has a role to play in protecting ourselves, our loved ones, and our community. Please get vaccinated as soon as you can and keep following those public health orders. That's the key as we beat this thing together. Thank you.
Thank you, Premier. This is an exciting day for community organizations, as we know that there are many people in our community that want the protection that vaccination offers. They want to do their part, and with the support provided to community organizations, we will help them get vaccinated. Last week, we hosted Manitoba's first drive-through vaccination clinic. The event felt more like a festival than a clinic. The outdoor space, which was right over here, afforded us the opportunity to have therapy dogs, bubbles, music, and snacks for everyone who received a vaccine. Our staff are very familiar and skilled at supporting people with disabilities and people who need additional supports. So our vaccinators were able to give vaccines to people who had previously been unsuccessful in other environments. We also saw people who were waiting for a clinic that would better suit their needs. As such, we were able to give many people their first doses. This week and next, our clinical team is working with other agencies within the disability sector to reach groups of people with a customized, flexible approach through recognized and trusted group. We also look forward to hosting additional drive-through clinics here at the Spirit Cottage weekly after that. We know that community organizations know best how to reach the people in their community, and we are grateful to the province for supporting community-led initiatives. Please welcome Kirit Thakrar, President of the Hindu Society of Manitoba, one of the grant recipients here today.
Thank you, John. On behalf of the Manitoba Hindu Society, we would like to thank Premier Pallister for this great outreach and community grant program that has been developed, and excited to be one of the organizers' reception. Also, on behalf of organizers, we would like to thank all the healthcare workers, many of whom are also members of our community, for all your hard work and sacrifice made over the last 15 months. Hindu Society of Manitoba will be hosting an appointment-only pop-up vaccination clinic at 999 St. Anne's Road on Friday, July 9th. Hindu Society of Manitoba, like many charities, have been impacted by COVID-19, as both our temples have been closed for over a year, both in St. Vital and downtown area. This grant will be used to promote vaccination, connect people with who may have difficulty accessing the vaccine, and provide a safe and comfortable place for people to receive their vaccine. Pop-up clinics such as this are even more important for communities like ours, where many are newcomers or English may not be their first language. We plan to have volunteers and experts on site that can assist in vaccination effort and can spend questions to answer any questions about vaccine. We'll be also reaching out to our neighboring communities and inviting them to attend this pop-up clinic as well. I'd like to thank John and the staff here at St. Amant Center, who have been providing advice as we develop our plans for COVID-19 vaccine pop-up clinic. And they have been such a great help. Thank you, John. Thank you again, Mr. Premier. And all of the healthcare workers who are working so hard to increase the vaccination effort in the province. On behalf of the Hindu Society of Manitoba, we are honored to have been selected for this grant and will continue to work hard for our community, the province of Manitoba and Canada. Thank you.
Thank you very much, Kirit. That's the end of our formalized program, so can I open it up for questions now?
I'm not sure I got the whole question. I best let you repeat it. I'm sorry. Oh, okay.
What should be done to address health
Well, we're here today talking about vaccine availability. Part of the criteria for establishing which organizations, such as the Hindu Society, which was chosen to provide some funding to assist them in promoting and increasing the awareness of the need for vaccines, but also availability with the pop-up. I'm glad to hear you're following through with the pop-up too. That's great. But the key here is to make sure that we're reaching out to those areas where vaccine uptake is somewhat less, where there are challenges, right? The challenges of language barriers are real. We had done advertising and promotional material in over 100 different languages, but it's the actual personal outreach, I think, that the projects that have already received funding are going to add to this. It's going to maybe add that difference, make that difference to persuade people. And that's the key to addressing the inequities of vaccine uptake across the province, most certainly. Community outreach. We have a community-minded province. We all know that, and we love that about Manitoba. This is a chance for us to actually activate those community organizations, cultural, sports, religious, you name it, in a way that can be very productive and help us get through this third wave. Well, quite frankly, we didn't have the vaccines early. They were very limited in availability and number. And so as you remember, we look back, it seems like ancient history now, but we were making it available to just seniors in seniors' homes initially and frontline staff initially because we had such a small supply. It's only in recent weeks that we've seen enough of a supply that we can do broader outreach. And those numbers I shared with you earlier are pretty impressive for the number of vaccines we were able to do in a single day. So with that expanded capacity, that supply, it makes other avenues of distribution possible. And so community outreach will get to some of the areas, I think, that where there's been some limited uptake and some hesitancy for some understandable and defensible reasons. But we do need to get everybody the vaccine as soon as we possibly can, not just to shorten the pandemic, but to avoid a recurrence or a bounce back, a yo-yo effect. We want to avoid that. We've seen that in other countries already. We don't need that here in Manitoba or Canada.
As of yesterday, we had about 72.9% the first dose, 38% the second doses. Dr. Rusin told us yesterday that at least one incubation period has to pass before this work can take place.
Sure.
From you, how soon in Manitoba expect to see this second phase? It seems like we're going to hit it probably more up.
Well, you know, I'm quite prepared to take criticism, as you are aware, and have in this pandemic for going too fast and too slow at the same time. So I'm going to say quite necessarily that we have to follow our health leadership recommendations, and that's what we've been doing, and that's what we're going to continue to do. I think it's just a very reasonable level of caution to make sure that we wait at least a couple, 3 weeks. We just opened up on Saturday, removed some restrictions, and when we have more contacts, we allow COVID to transfer. And so we know that when we reduce restrictions, the possibility is that COVID will increase. We have to monitor that, and very carefully so, because we don't want to have to go back into red again. And so I support and entirely follow the advice of our healthcare leadership here. I'm responsible for the decisions, but I really have great respect for Dr. Rusin and his team, and we do endeavor to follow their recommendations very closely. No, we already acted earlier, and you know, I think justifiably so. Manitobans responded really well to the challenges of getting to that initial milestone, and we're on progress to meet that second milestone a little sooner. So you know, depending on the health experts' recommendations, that may be a real possibility. I think Manitobans deserve to be rewarded, quite frankly. It's been a long time, and you know, the sooner we can get our freedoms back, the better. But we're not going to be going as fast as Alberta, for example, or Saskatchewan. Let's be clear. We held off the third wave much longer than Alberta, Saskatchewan. Most other provinces, in fact, had the third wave long before Manitoba got it. And we're ending it later than they did. But overall, our time in that third wave to the thresholds that the scientists use was less than most other jurisdictions. But we're not done yet. We're still, if you compare on the nightly news, you'll compare case numbers with other jurisdictions, you'll see that Manitoba still has somewhat higher case numbers than, say, Saskatchewan. Had a record low yesterday, I think the lowest since October. So they're reopening, and I'm not criticizing them for that, but they're later in the third wave than we are. So we may have to hang in there a little bit longer, but we're moving in the right direction, and I think that's the important thing to remember. We have to continue to get more vaccinations, make progress in that way. That's our best way out of this mess.
Hi.
I was wondering if you could just talk a little bit about what hesitancy you are seeing in the Hindu community right now that you're hoping to address to get more immunization rates.
Basically, what's happening is because of the language barrier to some people, like they don't understand like how important the vaccine is, like and what we're doing as a Hindu Society of Manitoba, also as Hindu Society of Manitoba, what we are doing is we are promoting. We are getting, like yesterday we had Dr. Anant, right? He came and talked about vaccine, like what it means, like some people are hesitant. Should they take COVID, Pfizer, or should they take Moderna? I think that's one of the biggest issue because of the confusing, right? And that's what it is, But I think lots of people are now beginning to understand, like they're both equal. Thank you.
And just the pop-up site is a little bit different. Are you hoping that will also service the Hindu community primarily? I heard you say it was open to everybody.
No, it's open to everybody.
Are you worried that maybe people, the way they've gone to sites that have popped up in the past in the hundreds, that it might overwhelm the site?
We're going to have an appointment too, so it'll be based on appointment. So, and this is our first time, so we'll see how it goes, Thank you.
Sure.
Not related to vaccines, but Manitoba Justice Scenario 3 and Civic Coalition claiming that Hydro isn't providing information. Has anyone in your government instructed Hydro
No. Yeah, no. Hi.
So my first question is, can you give a little more detail on the 20,000 vaccines? What type of vaccines, what types of community organizations are they looking to? Particularly the community living disability services program. There's a lot of people in that program outside of Winnipeg, so outside of St. Amant, that weren't able to access the sites and that are
Right.
still waiting for the private assistance.
Yeah, I would just say two quick things. I think the vaccine implementation task force will be able to give you detail on exactly which groups. On the second part, though, I know that they're very responsive and open to getting more inquiries about available possibilities. They've opened up dozens upon dozens of available spots for people to try to facilitate different needs, different tastes, different preferences. So I know that they'll be anxious to hear of any other suggestions. And just to follow up on that aspect, I think also it's important to reach out to other community groups and say, we have a lot of applications in. We'd like more. We'd like more because we believe that the community outreach that we're focusing on now is really the key, not just to getting us to 75, but to getting us to 80 and to 85% and even higher. We should aim higher. The higher we aim, the better. Because remember that at 75%, you still have a quarter of the eligible population unvaccinated. And that is hundreds of thousands of people who are at risk and who are putting each other at risk as well. So the more we can reach out to the communities effectively, the better results we're going to achieve together.
So go to the task force.
Well, we can provide you with specific answers. I don't have that detail with me here.
Okay, so on the topic of vaccines,
Sure.
the Healthy Hire program.
Yes.
Businesses are saying there's a lot of great things about it, that it is offsetting the federal program, that it is helping businesses get back on their feet.
Right.
However, some business owners are saying it's problematic that they're having to ask for someone's health information and that it's incentivizing business owners to ask about a person's vaccine status in order to hire.
It's an attestation form. We can get you a copy of the form. I think it's finalized. But it's simply an attestation form. It simply asks a person if they intend to get the vaccine or if they have had it. That's it. That's the full extent of it. It's not too much to ask. You know, it's $50,000 of taxpayers' hard-earned money that we're offering to businesses to help them get back on their feet. And if you're not willing to do that, then don't apply for the program. The program is designed to encourage people to get vaccinated, and it's designed to help small businesses get back going. And it will achieve those goals. We got compliments from other provinces, from the federal minister on this program. We're doing everything we can here in Manitoba to help encourage people to get vaccinated. I can say, and I'm a former small business person, I would say to the 95th percentile, small business people want to get going again, but they want to do it safely. They want to have a safe work site, and that means having your people get vaccinated. They want it safe for customers, and that means having your workers vaccinated. They want to make sure there isn't an unfortunate occurrence with respect to some of their suppliers and the people who come and work in conjunction with their workers. They don't want more outbreaks, and the way to get there is to encourage vaccination. So that's why the program Healthy Hire is labeled the way it is, because we are encouraging people to be healthy by getting vaccinated.
When there's one person who's vaccinated and one person who's not vaccinated, they're both applying for the same job. Some business owners feel that that is discriminatory to hire one person over the other.
Don't apply for the program. It's as simple as that. Don't choose the program then. If businesses don't want to access this money to assist them in getting $5,000 of wage subsidy for up to 10 employees because it's too hard, don't apply. The purpose of the program is to encourage that one person who isn't vaccinated to be vaccinated. How would you encourage them? Is there a better way? I'm open to hearing it. Otherwise, we're going to use this program to encourage people to make the plunge, to make the commitment, to apply for a job. You need to attest that you are either vaccinated or intending to be vaccinated, not once but twice. If you feel coerced, don't apply for the grant. Simple as that. We're not going to give out hard-earned taxpayer money in a multi-million-dollar program to allow a situation that has closed down businesses all over our province to continue to do that.
Non-vaccine related question.
No, we don't allow those here.
I'm going to ask you.
Okay, go ahead.
With Canada Day coming up, the calls to cancel Canada Day celebrations in light of the discoveries at Hindu sites. Is the province planning any Canada Day celebrations?
I'm not aware of any. There are a number of community groups. I know that some have expressed the intention not to hold events. Others have, I think quite rightly, expressed the desire to make sure that they encourage people to reflect on our history and the reality of our residential schools. History is an important part of that history that needs to be understood better, I think, by many Canadians. You know, I encourage people to celebrate our country, warts and all. I think we have no claim to perfection, nor does any country, but I think that Canada and Manitoba have worked very, very hard on many issues that we deserve to acknowledge. And we also have to work harder on some issues that we're now beginning to acknowledge better than perhaps we did in our past. I celebrate Canada Day every day. Thank you.